So 37 people in all were taken to LCMC hospitals. That does not include Oxnard Baptist Hospital. But I can tell you that of the 26 and then 4 extras, so a total of 30, who were brought to UMC here, the Level 1 Trauma Center, for the highest level of care, there remains 16 people in the hospital still being treated behind me, and 8 are still in ICU. Now, one of the doctors here said that even though they're used to treating critically ill patients, that this is probably the single largest number of critically ill patients that they had seen in a short period of time with this mass casualty event. And of course, they also had the task of reuniting families and helping families find people who were missing, who ended up being patients here. Take a listen to what he had to say. Inevitably, with this horror, there were going to be people who could not be saved. How does the staff deal with that?
You know, it's really tough. We see death here, as healthcare providers, as part of our jobs, but it's still not easy. But you hear that we have, 26 critically ill patients here in the hospital, but there's multiple deaths on scene. That can take its toll, and that's difficult. It's difficult for the caretakers, it's difficult for the patients, and it's difficult for the families. And so we just try to keep doing our job here, care for the patients that we have, and then ultimately care for each other.
And a huge thank you to the community. 300 people turned out to give blood yesterday, and a lot of people were coming out today as well to the blood centers around the area. So you can still do that tomorrow as well. Reporting live from UMC, Meg Farris, WWL, Louisiana.
All right, Meg, thank you. And speaking of those blood centers, from blood donation drives to donations, there are a lot of ways you can help the victims. Many have GoFundMe set up. There's also a United Way fund and more.
And we have links on our website, WWLTV.com, where you can find out all the information you need on how to join in each of those efforts.